Sorry about that. Anyway, what I was saying before when I was on mute was back in February when Angelo actually helped us launch this collaborative initiative. I think he really painted a really visionary idea of how do we work beyond our typical kind of operations so that we're really doing everything that we can to improve the healthy communities and to really raise population-level health. And so in the spirit of that, this webinar is along those lines, but is a little bit different than the types of webinars that we've had prior to this. Prior to this, we've really focused on the food access piece of it. And this is going to be an interesting discussion. We have Dr. Bashia, who's going to talk about how he used the operations that he had through environmental health and doing restaurant inspections, and how they were actually able to also look at the social determinants of health and look at income for restaurant workers. So I think this is a really innovative approach, and it should be interesting to hear about that. And we hopefully will have time for discussion to kind of hear how that rolls out and what maybe the political context would be for doing something like that, or if there would be a possibility for something like that in some other locations. So with that, I'm going to turn it over to our chair, Gail Hoxler from Riverside, to do the introductions. And I'll just remind you to do what I didn't do, which is the *6, so that you're unmuted.
Good afternoon. Thank you, Tracy. It's a pleasure to have this webinar this afternoon. It is actually our Public Health Alliance and Environmental Health webinar series call number 7. So it's a pleasure to have the topic, as Tracy mentioned, and to introduce these two great speakers today regarding the environmental health can protect the health and safety of restaurant workers as a collaborative effort in San Francisco between the health department, low-wage worker advocates, and labor leaders to support the larger issues, as we mentioned, with health and social determinants of health by labor standards and restaurant inspections, as Tracy had mentioned. So let me tell you a little bit about the two speakers that we have today, and then I will go into them and we'll go from there. Dr. Rajiv Bhatti, I apologize if I didn't get your name correct, is founder of the Civic Engine, is an internist and social medicine practitioner with 2 decades of experience in advancing population health needs, including environmental quality, economic opportunity, and political inclusion. He has a broad experience and expertise in the generation, analysis, and communication of data and information to inform public policy, catalyst civic engagement, and monitor governmental accountability. From 1992 to 1996, Rajiv practiced primary care medicine in San Francisco's medical safety net system. From 1998 to 2014, he was the Director of Occupational and Environmental Health at the San Francisco Department of Public Health, where he founded the program on health equity and sustainability and designed and implemented laws, policies, and programs for noise and air pollution control, transportation safety, healthy housing, food security, and workers' rights. With that, he also has a speaker, Karen Yu, MPH, Senior Environmental Health Inspector for San Francisco Department of Public Health. She works within the Department of Environmental Health for San Francisco, and through the years has worked in food hazardous materials, housing, childhood lead poisoning prevention, and occupational safety and health training for workers. Currently, she is also partnering with local, state, and community-based agencies to gain compliance with labor code violations. So welcome, Rajiv and Karen, and I'll go ahead and start the webinar.
Thank you, Gail. And just a reminder to Rajiv, in order to speak, you need to dial *6. And just let us know by saying next slide when you want to move on to the next slide of your presentation.
So I'm assuming you can hear me. Can I just talk via my computer instead of holding the phone to my ear?
You can, but do you want to? You need to put your phone on mute in order to switch.
Yeah. I'll do that. So let me just try that.
Okay. And just for anyone who's having trouble with the Start Meeting software, this presentation is available at our website, which is phasocal.org, and it is at the top of the website. You'll see a tab bar that has EH7 at the top, and that is the page for this presentation. And you can download a PDF of this presentation and follow along on your computer in case you're having any trouble. Rajiv, were you able to switch successfully? I'm just going to check and make sure you're not muted on your computer. My apologies, everyone. We'll try to unmute you. Rajiv, are you able to speak on your computer? It doesn't sound like that's working.
Hello?
Oh, there we go. Okay.
Okay.
And
how's that?
You sound good, a bit echoey, but and your phone is on mute or off, right?
I'm about to end the call on the phone.
Okay, great.
Okay, I can step back a bit. Thank you for inviting me to this call. I think the work we did on restaurant worker health and safety was probably some of the most important and innovative during my time at the health department, and I'd love to share it. I'd love to see it sort of spread and grow throughout California and the rest of the country. So I really want to make this my presentation or talk fairly brief, so we can very quickly get into a discussion in order to take these ideas in whatever form to other places. They're going to have to be criticized. You on the phone are going to have to criticize them and find ways to, how or what part of these ideas can be adapted or used in the places you work, because there's no, I think there's no simple cookbook for doing this. But hopefully this work that I'm going to share will be sort of inspiring and give you a sense that when restaurant workers are being exploited and environmental health is regulating the restaurants where they're being exploited, the environmental health professionals don't have to be silent. So, Carla, are you going to advance the slides, or do I also have control? Okay, great. So I think that hopefully these are facts that are well known to all of us. But what's the economic context in this country right now? We've had about 3 decades of wage stagnation, and there's been no growth in the middle class. And for those who have worked in government and for environmental health, we've had it pretty lucky. Our wages have been steady. We've gotten raises from time to time. Our health and safety rights are protected. But in the communities we regulate, the conditions of the workers aren't so lucky. And so we're out there regulating the restaurants, regulating the businesses to protect the customers who come into these businesses, to protect communities who might be affected by hazardous materials. But we just walk right by the workers often, and those workers are actually bearing, I think, probably the largest health and safety impacts of those operations. And restaurant workers are particularly, have it particularly bad. As the restaurant workers have some of the lowest wages in the country, particularly those who are untipped. Because of these wages, they themselves, even though they're working in restaurants, their families often face food insecurity and housing instability and financial strain. Restaurant workers are exploited. When you look at the industries that where you find unpaid overtime and wage theft, restaurant work comes to the top of the list. restaurant work is a hazardous occupation. There are dangerous working conditions from slips and falls, from burns, from overtime, from lifting, that are sort of they're rampant and often accepted. There are public health risks. Only 10 or 15% of restaurant workers have paid sick days, yet our laws say that sick workers can't work. So we have a law that prohibits the worker from working, and we have employment rules that don't guarantee that sick worker a paid day off, even though the reason the worker's at home is to prevent the public from getting sick, not to improve their own well-being. And there's a general lack of labor safety, labor and safety enforcement. The restaurant industry has not been one of the industries that our occupational health and safety colleagues have focused on in protecting health. The next slide. So that's a lot, right? And I don't know, and it would be good to hear from you who are out in the field, across California in restaurants and interacting with workers. You're often interacting with the managers, but what conditions you see that I'm assuming that this was very obvious for us in San Francisco, walking into restaurants and interacting with restaurant workers. But it would be interesting to know what what others on the call have seen. And here's just some quotes. We got into this work for a number of reasons, and Karen's on the phone, and Karen was really, to be honest, Karen's the reason we did this. We started this work. She began of her own sort of volition to do health and safety training for day laborers, and from that starting point, our interest and commitment to low-wage immigrant workers and their health and safety needs only grew as we developed relationships with community organizations and advocates that were working on this issue. Here's some quote. This slide has some quotes from restaurant workers and other low-wage immigrant workers in San Francisco, and I won't cite them because I think you can see them on the phone, on the screen. So next slide. So what we, as we research the situation, and I think this research began sort of in solidarity with community groups. We had worked successfully with day laborers on a vocational training program that sort of integrated economic security and health that was funded by a federal grant. And from there, we met and developed relationships with other groups working on labor issues in the city. We worked with those groups on citywide laws, including increasing the minimum wage and the first in the country local paid sick day law. And through that work, and after those laws were passed, and we had a high labor standard, we realized our next step was in getting the laws enforced equitably for everyone. And it was apparent that the conditions in the restaurant industry were not that conducive to the workers actually having the laws enforced. I mentioned few restaurant workers have paid sick days, and the work environments are dangerous. What we found doing local research was less than 30% of the restaurants when we looked in a few neighborhoods, posted the required worker labor notifications. That was a simple thing to fix. With research with the Chinatown Progressive Association, we found that among the workers working in Chinatown's restaurants, 50% earned less than the minimum wage, and 20% were working 60 hours a week plus without any overtime benefits. And from our local Office of Labor Standards Enforcement, we learned that the restaurant industry had the largest share of local labor law violation complaints in the city. Next slide. So we did a number of things, and I mentioned before we worked with restaurant workers, we had done policy research on the health benefits of a local minimum wage law and paid sick day law, and we had been able to communicate those health benefits to policymakers, and we hope that helped, that contributed to the passage of those laws. So we did, we wanted to know the facts, and we did the action research with Chinatown on Chinatown restaurant working conditions with participatory research professor Meredith Minkler at Berkeley and Chinatown Progressive Association, which was an organizing group in San Francisco's Chinatown. From the standpoint of having the facts, we felt that there were a few things we could do fairly easily. One was having our inspectors just monitor the labor notifications and provide that. So staff were asked to look for these labor notifications, note it, and issue a violation if they didn't find them, and actually provide the restaurant with the required poster, telling in the appropriate language, telling workers their rights. That was a really easy one, and we paid for the poster. It wasn't an expensive thing to do in terms of its benefit. A little bit more work. We began requiring all restaurants to prove that they had adequate workers' compensation insurance. Many restaurants had workers' compensation insurance, but maybe they weren't. It wasn't adequate, or they weren't accurately providing, putting down all of their, full-time and part-time employees. We made them provide the documentation and made that a routine part of the permit issuance process. We also did random spot checks in restaurants on existing restaurants, and that random spot check showed that on initial asking, a large a majority or a substantial fraction of the restaurants didn't have workers' compensation insurance or adequate documentation, and it pushed them to get it because they knew we would be looking for it. I think a little bit more bold, maybe quite a bit more bold. We did a careful reading of the laws in California and our local local wage laws, and basically they say that if we're going to give a permit to a restaurant, if we're going to give a permit to a business, that business has to abide by all laws. The business doesn't have to abide by food safety laws. The business has to abide by fire safety laws, planning laws, building laws. We know this. In the permit issuance process, environmental health checks to make sure that the fire, building, and planning codes are enforced. Well, the same language applies to labor laws. It applies to getting a business license. So there were a set of things that were included in the scope, just in the same way that that building and planning are included, that we hadn't been looking for. So what we had the advocates and our partners in the community said, we're making complaints about these wage theft and other wage right violations. We're going to the labor enforcement agencies. They're doing an investigation. They're finding that our rights were violated. They're issuing an order telling the restaurant to pay the workers, but the restaurants are just waiting because they know that the labor enforcement agencies don't have the same tools to make them pay. So they're delaying. They're waiting for the city to take legal action. we had a much easier route. We could take those facts, and these are not little facts. These are fully blown investigations where the restaurant has been demonstrated to not pay its workers' wages. And we said simply to the rest, we brought them into a hearing and said, you've been found through the facts that you're not paying the workers' wages, and there's an order against you. And until you pay the wages and pay the penalties under the order, we're going to suspend you. We're going to give you a little time to decide what you want to do. But if you don't follow the law, we're going to suspend you. And that got them to act almost immediately. And so we basically, I think that it didn't take very much time, but it helped workers and the city recover wages and the penalties due. The future for this, and where I kind of left it, and I'd love to hear from Karen, when I get done with my part, is that we were exploring how we could do coordinated surveillance and enforcement with labor agencies. Again, this is not new. We often work with the building department or the planning department on environmental conditions. We realize when one environmental rule is being violated, there may be others. In San Francisco, we did this frequently with single-room occupancy hotels, bringing the planning department, the building department, the city attorney, and the health department on poorly managed single-room occupancy hotels, because all of us needed to work together. Because there were violations, in all domains, and all of us could work together and take one coordinated enforcement action instead of 4 separate enforcement actions. Well, there's the same potential, I think, with on the labor side, the places where we're seeing, if there are rampant labor violations, they're more likely to be health and safety violations. These things, they're not perfectly, but they're correlated with each other. So the health, we in health can use labor violations or knowledge from our labor enforcement colleagues to help target where we might be doing more proactive food safety inspections, and they can use information on where there are more chronic food safety violations to say, well, maybe there's a higher priority, a higher likelihood that we should be looking for labor violations. So that work never, I think it's still in the kind of the thinking phase and reaching out to labor agencies, both at the local level and at the state level. Next slide. So here I'm just providing you the legal authorities that we used in taking the action on wage theft in suspending restaurant permits. And I think you can, yeah. And so let's next slide. I think you went back other way. Oh, yep. So this is the last sort of group of slides, and I think these slides are really to show that there's something called essential public health services. There's 10 essential services. They're in this slide, in the next slide, in the first column, and this is what all public health agencies are instructed are the essential public health services, and now we have something called accreditation, where public health agencies are asked to sort of demonstrate how they're achieving these public health services. Well, the work that we did in working on labor issues can be seen really as not innovative, but just kind of day-to-day what we should be doing in terms of the essential public health services. Monitor the health status and identify community health problems. Well, realizing who's not being paid wages. Income is the single most important factor that makes a person healthy or not. Without income, without sufficient income, you're not able to eat healthfully. You're not able to live in quality housing. You're under financial strain. You're not able to do quality parenting. It's really the worst thing, and we can be monitoring this. We can be informing and educating both employees about their rights and employers about their responsibilities. We can be telling our policymakers, our legislators, where these problems are and what kind of policy solution should be implemented. I think as the environmental, we really in environmental health, we take food safety seriously. I think if we take food safety seriously, we have to insist that the states have a paid sick day law that's adequate. And we, after many years, we just passed a paid sick day law in California that's going to give everybody 3 paid sick days after a minimum of 3 paid sick days after 2015. Well, I think restaurant workers who were saying, please don't go to work when you're sick, they should have, perhaps a higher standard of paid sick days when they have an infectious disease. Mobilize community partnerships. This work couldn't have happened without a couple of things. One, the partnerships with community organizations that both helped us learn what was really going on and helped us find solutions and get the political support for solutions. It also couldn't have been done without, I think, people within our agency like Karen, who are sort of deeply committed to social justice and willing to go above and beyond to move these ideas forward. Next slide. So this slide has a few other things that we can be doing. An essential public health service is enforcing, but just I think follows in the point that all the things we did were essential public health services. They shouldn't be. I shouldn't be here telling you about this work on a PowerPoint. We should all be doing it kind of day to day. I mean, in a webinar, we should be just sort of doing it day to day. I'm hoping this kind of work becomes more routine and more normal and more natural. So I'm going to stop there. I think hopefully it's been intriguing to you, and we'll have a good discussion in a bit.
That was great. Thank you, Rajiv. And Karen, I didn't know if you had anything to add or wanted to comment on how this work was continuing. And you'll have to dial *6 in order to speak.
Okay. Can you hear me?
Yes, thank you.
Okay. So perhaps I can just give you a few real examples to illustrate what Rashid had talked about. In the beginning, it was just the local wage enforcement agencies coming to us with a simple case of unpaid wages that they have already settled and had a judgment, but the owners refused to pay. And so even after 2 years, they still have not paid those unpaid wages. And so they came to us finally for assistance, and we took them to the directors. And within 3 months, I forgot how much, but it was over $10,000 that salary was paid. So we just really began to see how easy and quick our process can be in comparison to the process that they use in order to get a judgment, get a settlement, and get the wages back to the workers. But now the work has kind of transformed itself a little bit, where we are actually the health department is actually benefiting from this partnership as well. Because what happens oftentimes is when they're investigating these cases, their ownership problems arise. For I think it's due to the fact of how our city structures, business permit and health permits system, how we put those things together. Oftentimes, the owners will be playing games as to who the real owner of the business is. So now we begin to coordinate. They would call us, the labor agency would call us and say, on the health permit record, who's the real owner. And in that process, we have discovered that there are businesses out there operating without a valid health permit. And, then we go out there after this notification from the labor agency, and we go and straighten that out. In addition, like this just today, I was elated when one of our food safety managers, one of our principal inspectors, came to me and said, "We have a business here now. He hasn't paid his license fees for years, and we're having trouble with that. And I'm going to take him to a hearing next week. Karen, are there labor issues that you would like to include into this?" I was really happy because this is the first time in which this is going in reverse, this whole process. So I'm really happy that, this collaboration with the other agencies have really benefited both sides. And I just want to also mention in brief of why I think, because, we all know that it's very environmental health has operated the way it has operated in these very designated realms like food, water, hazardous materials for decades, and it's very, very difficult for us to change. But I think that we have been able to do some of those changes, of course, largely due to Rajiv's leadership, but also because I think we try to do small things and we began slowly. And we try to still have a regulatory role. We try to speak still the regulatory language when we're doing labor work, and so it's more acceptable to the rest of our colleagues, the food inspectors, for example. And I think we have also just play a supportive role. For example, I don't do any of the investigations of the labor law violation. That would be just too much work. Basically, the local enforcement agencies, the labor enforcement agencies, they do all the work, and they have already found the owner guilty of wage theft. And then they would just come to me with that evidence, and I would just present that to the Director of Public Health. So my role is very minimal, and so it really helps with our workload. And so I think those are some of the, I would say, key, if somebody else wants to do this, is to try to keep your roles simple, narrow, stay within our traditional roles of environmental health, but expand it to this area of promoting health and protecting, chronic diseases. So I would open up for questions.
That's great. So thank you both so much for your presentations. And if we can, we will open the floor now to some discussion. I hope we can have a good discussion. Again, please dial *6 to unmute yourself, and you can repeat with *6 to mute again. But maybe just to open the floor, or do we have folks on the call who have done this type of work or who are looking at integrating this into their work processes at this time? Maybe that was a difficult beginning question. Are there folks who have questions for Rajiv and Karen about their work?
Tracy?
Yeah, go ahead.
Yeah, this is Angelo Bellomo. I just wanted to congratulate both Rajiv and Karen for this excellent extension of the conventional work that we do. And I wanted to know how much additional work have they encountered? What does it really take to the existing work of the health department while they're in doing their conventional inspections to be on the lookout for these types of conditions and to make the appropriate referrals? How much additional workload is that?
Rajiv and Karen, are you having a hard time unmuting yourselves?
Can you hear me now?
Yeah, I can hear you.
Okay. I think in terms of looking for the posters, it's not a big deal. It doesn't take too much time. Sometimes it may take a little bit more time if the owners had questions. But I think that the inspectors would then tell them either to call Karen or they can explain it themselves. But in terms of bringing these cases to the director, I would say it would take a couple of hours. The whole process may take 3 or 4 hours, and that would be it. Because basically, the labor enforcement agencies, such as the Department of Industrial Relations or the Office of Labor Standard Enforcement in San Francisco, they do all the preparatory work. They're basically making a complaint to my office with the supporting documents that the business owner has been, violating wage theft or no workers' comp. And they just present the facts. And I go to the hearing, and they come, and they make that presentation. And then at the end, I just write the order, and I simply follow up. So I find that fairly easy to do. So it doesn't really take that much time. So far, I'm the only who's doing this work here because there aren't that many cases. And so basically, I would say it takes way less than 10% of my time.
So can you guys hear me?
Yeah.
Yeah, okay, so I think just to extend on what Karen's saying in a couple of ways, I think there's a big menu of things to do, and you can start small, you can start big, but I think the other point here is that that a few cases can really set a precedent, or they can set a standard for the community. So the idea isn't like restaurant inspections where we expect to continue to go year after year, a couple of times a year, to do a standard inspection. If we send the message that wage theft is not tolerated in our communities, and that we are not going to tolerate restaurants that don't pay their workers, follow labor laws, we're going to make referrals. And we make referrals to the building and planning agencies all the time. I think, I think if we want to know how much time that takes, we can look at the existing time it takes when we notice a building code violation or a planning violation, how long those referrals take. But by doing it, because we're the most frequent and most regular viewers, inspectors in the field in these restaurants, a few cases will really set an example, and then conceptually the number of new cases will decline. So I think it's really there's a little bit of startup cost, both culturally and perhaps a little in time, but there's likely to be a motivated value-aligned health inspectors or inspectors who are willing to take up the work. People who've come from these communities and who really have seen these problems firsthand. People whose parents maybe have worked in restaurants. So I think it can be done for limited cost and really set an example. And it shouldn't be seen as kind of a long routine, that sort of institutionalizing sort of significant new work for the institution. Another really easy first step would be to I would say if people wanted one thing to do kind of after this webinar is go and meet with the labor violation people in your community. I think or meet with the state labor commissioner and say, look, we're willing to work with you and help you get enforcement on these laws. We don't have a lot of time, but tell us what to do. I think that would be a really simple and easy first step.
Great, thank you very much.
Rajiv and Karen, this is amazing work, and for me it's really inspiring to hear how you guys kind of looked at this problem and came up with a way to approach it. For those of us that live in these more conservative jurisdictions that are, quote, business friendly, of course we don't want any businesses violating labor laws. I'm just curious, did you also have or do you also do outreach to the restaurant associations to kind of provide them with a little bit of education as to this is what we're doing, these are the approaches that we're going to be using?
Yeah. Karen can speak separately, but yet, yes, we did. And in my conversations with the Golden Gate Restaurant Association, they were all for this. They said if we've got restaurants in San Francisco that are not that are committing wage theft, and frankly anything else, if they're putting customers at risk, we want you to take clear enforcement action on them. It's unleveling the playing field for all of the businesses who are doing a good job. It's a very small minority of the businesses, and the rest of the businesses who do pay wages and overtime and take care of their workers, and it's unfair from a business perspective for them when they have unfair competition from employers that exploit workers.
Mm-hmm.
As far as I know, nobody has stepped up to defend any of the restaurants that have been committing wage theft except their own lawyers.
Yeah, I've never heard anything negative from the business community because they don't want somebody to be, getting away with not paying workers' comp or wages when they have to be paying it. So it really is helpful and fair to everybody. So everybody agrees with this.
And another question that I've got kind of along those lines also is, you guys had minimum wage ordinances. I think that, we're all beginning to look at, or many of our areas are looking at living wage ordinances as well. And it seems to me like this might be a really interesting approach to do in tandem for those communities in particular that are looking at some of the living wage ordinances. Just was wondering if you had any thoughts about that or recommendations.
I wouldn't wait, Tracy. I think that yes, but it's almost like this is regardless of what the wage is supposed to be, there is a group of employers that are exploiting workers and not paying that wage. We can increase the wage and we'll still have that group. So it's almost like this has to kind of happen first. Let's get and we've at a state level. My guess is that we're not going to see, maybe outside of, San Francisco and Santa Monica, we're not going to see significant changes from the new state minimum wage. And quiz, what's the state minimum wage going to be? What's it now? What's it going to be next year? Okay, check it out. We recently increased the minimum wage in California, and it's going to go up to $11.
right. Are there other questions or comments from participants?
Larry Fay here, Santa Barbara County.
We hear you. Great.
Great, good. I was waiting to hear on that. Rajiv, just a quick question. Is good working with the, well, first I agree with Angelo. This is really great and interesting stuff and not something that we would normally think about in the course of our work as being an area that we could heavily influence. I just took a quick look at the Retail Food Code, and I can see easily the connections that you've made between permitting suspension and the basic requirement to comply with other laws. Did you have any challenges at all working within your, and I think this might be some of the question that Tracy was getting at, working within your political environment and your legal environment, or did you find just a real quick grasp of the issue and support for pursuing it?
Yeah, so again, this was, let me go back through the kind of sort of steps we took. One, we recognized this as an issue. We had community partners that we were working with on, in general, better labor conditions. They shared with us their challenges of not getting labor compliance. We talked to the labor regulators and said, well, you have this law, why can't you get enforcement? Why can't you get compliance? They explained to us their hassles. We looked at our law, thought it was permissive. We had the analogies to shutting a restaurant down for planning violations, shutting a restaurant down for building violations, for fire violations. We thought that this was a simple extension of that principle. I talked to a city attorney, a deputy city attorney, and I didn't, it's always important. So whenever we talk to the city attorney, we have to ask the question in the right way. I asked, is there any reason I can't do this as the environmental health director? Is there any reason I don't have the discretion to do this? She said, no, you have a correct interpretation of the law, and there's no reason to not do this. It's your choice. And then we did it. And the only people who were upset were the lawyers of the restaurants who were exploiting workers. And I guess that, it'd be pretty hard for anyone to come and say, gosh, Director of Environmental Health, why are you suspending a permit of a restaurant who has not paid their workers' wages? I could give both a legal answer as well as, a moral answer as well as a public health answer. I don't think anyone would really, even if they felt it in their hearts, wouldn't really want to step up and ask that question politically.
Thank you. Makes a lot of sense to me.
I guess a question that I have, and it's more for the group, and maybe Rajiv and Karen can comment on it, is, are there any folks out there that maybe would be interested in at least exploring it? And if so, is there anything that we can do that might help support you in that? Is there any materials that we could bring to you, or any kind of further discussion that might help you explore this more? So I just kind of want to throw it out to you guys to tell us if there's something else that you would want from this.
Well, I can tell you, this is Larry Fay again, I can tell you I find this really interesting, and from my standpoint, I think I'm going to start by trying to track down who does our labor law investigations here in Santa Barbara County and see what their experience has been, because this just seems like a really straightforward partnership that can do a lot of good to one of the most impacted populations in our community.
Mm-hmm. Great, happy to hear that. That makes us feel good. Is there anything?
I would like to make a comment.
Yes, please.
Okay. My recommendation is that if you're going to start with something, I would start with the workers' comp. to require proof of workers' compensation in your application packet. Every time somebody either change of ownership or apply for a new permit or even to renew, that you would ask for proof of workers' compensation. The reason is it's really simple. It's just a piece of paper, and we're not making them get workers' comp. We're just saying you have to have workers' comp in the state of California. Just provide me with a piece of paper. And the reason is if they don't have workers' comp, the health system, the local health system, bears the brunt of the cost when they go to the clinics. And the other reason, I just spoke with the workers' comp deputy labor commissioner. He's the inspector for the workers' comp at the state level. He said, I can see the difference in San Francisco. Most people, most restaurants, there are a few here and there, but a lot more than other counties, they have workers' comp. They may still be lying about how many workers they have, but they have workers' comp. And so I think that would be the simplest thing to try to start.
Tracy, I have one other sort of suggestion. I mentioned it previously, but I want to maybe refine it a bit. There's, so for most localities, there isn't a labor office. We have a labor office in San Francisco because we have local labor laws. So if there is no local labor law that's different than the state labor law, there's unlikely to be a local enforcement agency for that law. And it's at the state labor commissioner's office. The state labor commissioner is very, very motivated and very motivated in working in partnerships and is working in partnerships with other disciplines. There's strength in numbers. So, and I think that if a group of environmental health directors went, 2 or 3, and went and met with Julie Sue, who's the state labor commissioner, and said, look, we know that restaurant workers are, some of the workers that don't get their labor rights, met. We'd like to start working with you in partnership and offering, monitoring and enforcement support within our constraints. Can we start that discussion? Maybe do this presentation for her and her staff. I think that would be very, very well received, and everybody collectively on the phone could figure out how to move this forward together.
Great suggestion, Rajiv.
Rajiv, would you be able to help us with the presentation and come with us?
Yes, I'm volunteering.
Okay.
Well, this is Angelo. Count me in on that one. I'd love to participate in that meeting.
Yeah, I'm with you.
What was that?
I'm with you, Angelo. Count me in.
Okay, and if there's other takers, you can let us know now, or if you can reach me by email, that would be fine too, and we would include you on that. So that might be the beginning of an interesting collaboration. Thank you for that offer, Rajiv.
Well, that's great. And this is Carla. I just want to say I think we're pretty much at time for this call. But, again, you can email Tracy if you're interested in participating in that meeting. And then I also wanted to let you know that a range of articles that have been published on this topic and other resources are available at our website in the EH Call 7 tab at the top. We'll move that over to our Food Systems tab in a few weeks. But if you want more information, you can access it there. And, and Gail, do you want to just close us out here?
Can you hear me?
Yep. Thank you.
Thank you. I just wanted to thank everyone for joining us. Again, was a fabulous webinar, our number 7, and a great number of attendees. And I think this webinar brought to light a different aspect than what we've been having over the last couple months. So I want to really thank our speakers, Dr. Rajiv and Karen Yu. Thank you so much, and all the input from the attendees.
Great. Thanks, everyone. Have a good rest of your day.
Thank you.
Thank you.